See You Now is a podcast highlighting the innovative and human-centered solutions that nurses are coming up with to solve for today's most challenging healthcare problems. Created in collaboration with Johnson & Johnson and the American Nurses Association, and hosted by nurse economist and health tech specialist, Shauna Butler.
The American Nurses Foundation commissioned the first study of nursing and philanthropy. So then what percentage, of all private donations actually support nursing? And, the headline is 1 penny of every dollar. How could that possibly be?
It's confirmed what we had already thought, and I think it's just given us even more resolve to understand the massive need to be investing in nurses and nursing.
When you provide the right opportunity for nurses to excel, patients gain in every way.
Our giving is through a holistic lens in everything, whole body, whole person, whole family, whole community. Pieces fragment. Whole puts everything together.
If you looked at all the dollars that are given in healthcare and imagine, what if 20% of that went to nursing? It would be mind-boggling.
It's exponential what the money can do in the right places.
Welcome to See You Now. I'm Shauna Butler. 1 penny. Can you believe that? Only a penny of every healthcare philanthropy dollar goes to nurses. If you're scratching your head wondering how that makes sense, you're not alone. Everyone has benefited from the expert care of nurses, who are essential and indispensable to healthcare. Nurses are clinical experts who make up the largest portion of the healthcare workforce. They spend more time with patients, families, and their communities than any other healthcare provider. Nurses are responsive and innovative, and they are uniquely positioned to use their expertise to transform healthcare and achieve health equity. Transformation of our complex healthcare systems requires vision, innovation, a commitment to long-term change, as well as substantial funding. Philanthropy will be crucial in creating and scaling positive change, which is why the American Nurses Foundation commissioned the first of its kind report to understand the landscape of philanthropic support for nurses and the nursing profession. In this first of a multi-episode series on investing in nurses, we bring you rare, in-depth, unscripted conversations with philanthropists, fundraisers, program managers, executive directors, grantees, and innovators behind these creative, strategic, and evidence-based approaches to investing in nurses. Learn why it's so impactful and why it's so urgent.
I am Kate Judge. I am the Executive Director of the American Nurses Foundation. I come to this role after pretty much 3 decades of being around nursing and nurses and healthcare delivery. At the American Nurses Foundation, we support the transformation of the nation's health through the power of nursing really as the lens. Our foundation commissioned the first study of nursing and philanthropy, philanthropic support for the nursing profession, priorities and potential for transforming nursing and achieving healthcare quality and equity. We released on National Philanthropy Day in 2023. The report has many key findings, and I'd like to highlight a few of them. The most important being that 1 cent of every dollar isn't enough to create the kind of transformation that we all need in healthcare. So that's the very first finding, of course. But really then it's an issue of where are dollars given right now and where are they needed in the future? So one of the findings is while we are investing in people to come into the profession, we're not investing in the leadership of the profession to drive us forward. The continual workforce development is something that is not at this moment receiving the sort of philanthropic investment, preparing them for a world that is constantly changing. And we need the providers of the majority of care to not depend on what they learned 10 years ago, but really continue to develop the workforce. We know that investing in new ways of delivering care is absolutely essential. Care outside of an acute care hospital, care in the community, care at home, and nurses are absolutely critical to that work. We know that the nursing workforce needs to better represent those they care for. We aren't investing in diversity, equity, and inclusion the way that we need to. And that takes investment. It takes dollars to be able to do that. And nursing, one could say, deserves it. I would say it's more than an issue of deserving.
Yeah.
I would say it's crazy not to invest these dollars. It just doesn't make sense to not invest in this critically needed clinical leader that is there for you and your family from the beginning of life to the end of life, and all the messy in-betweens, and all the places and spaces where you need your healthcare partner to really understand what motivates you, who you are. It takes time, and it takes attention, and it takes a particular holistic view that nurses have. And I want that holistic view to help drive a different kind of healthcare future for all of us. And I believe that one of the spaces and places we need to change is where the dollars go, both from philanthropy and in the healthcare finance system overall, so that we get different results. We can't keep doing the same thing. And one of the things that we've done over and over is underinvest in nursing.
So Kate, who is the American Nurses Foundation, and what's the mission?
Well, Shauna, our mission at the American Nurses Foundation really is our mission at the American Nursing Association and the American Nurse Credentialing Center. And that is to transform the health of the nation through the power of nurses. And we at the foundation do it through bringing philanthropic dollars into the hands of nurses and letting them do innovative, creative things, using dollars to support nurses in many different ways. And I'll say that in the pandemic, it was an extraordinary place to be at this intersection of nursing and philanthropy, because so many people knew that they needed to help, but they didn't know where to go. And so that there was an American Nurses Foundation was healing, I think, for people. And it was a great opportunity for us to receive those dollars and then support nurses and support other nursing organizations. We made grants to schools and universities. We really, we need to do this work together with many, many people. So while we are a unique organization, we are also linked to so many other organizations and solvers of problems.
I was reading more about the foundation. I love this line. It says, we achieve this by finding and funding new ways to solve problems, generate new ideas and tools, and lay the framework for advances in research, education, and clinical practice that enhance nurses' health and improve patient care. And how wonderful is that you've got a philanthropy that, in addition to seeking the best outcomes, it's also there to protect and improve the health and well-being of the nurses who are actually delivering the care.
The economy rests upon healthcare. If you do not have a strong healthcare system, the economy really falls apart. And the healthcare system really stands upon the shoulders of nurses. They provide the vast amount of care. But if you have nurses who are unhealthy, who are really burdened with the stress of what they do every day, it is hard to be a nurse. So the health of nurses is something that really is a cornerstone of what people should be looking at and caring about in the healthcare system. We have, in partnership with ANA, for many, many years, invested in the health of nurses. ANA has a Healthy Nurse, Healthy Nation program. The foundation has a well-being initiative, all to provide resources, large and small, to help nurses with their own health. Now, that said, it's not just upon the nurse to be healthy. We have to have them in environments that don't take away from their health, but actually enable them to thrive.
So, the philanthropic support for the nursing profession report. I have to say that the findings, they were sobering. It confirmed what I suspected, but it was still, honestly, discouraging to see the numbers and to read the commentary. So what prompted the foundation's philanthropy report, and what were you hoping that it might achieve?
Well, Shauna, I found the report sobering as well, though for my 3 decades in and around nursing and supporting them, I always felt that the philanthropic support that nurses get probably is in the single digits, but no one had ever looked at it before. And so we commissioned this first ever study to help make the case for why investing in nursing is important. And so first we had to look at the environment and say, is it happening? So the data that is available is about how foundations made gifts and looking at all of the giving in healthcare, and then what really came to what we described as nurse-led, nurse-focused programs. And, the headline is 1 penny of every dollar. And when you think that nurses provide 94% of care, and they are such a central part of care delivery, how could that possibly be?
Yeah, I mean, that headline, are nurses worth only a penny? So why has it taken so long for us to examine this?
Well, Shauna, I think there's several reasons, but I'll point 2 out. One, I think pre-pandemic, nursing is unfortunately too invisible and too expected, but not appreciated. I think that nursing has been generally not studied and not, in some ways, valued. So it wasn't completely surprising. And the invisibility is something that goes back a long, long way. Many tie it to the reimbursement for nurses, where nurses fall, where they're invisible in the healthcare system. And I think that is part of why they haven't been studied. And that's part of why we commissioned the first philanthropic study of the nursing profession.
It's interesting. It's such a paradox because in the care environment and as the face and the image that people have of care, I think that nurses are highly visible. But when it comes to policy and research and the financial models, that's where we become completely invisible.
Well, and I'd add to that in philanthropy. That's part of what our study is showing, is that nursing is not as visible as it needs to be. And I think for my profession of people who raise money, I don't think ask enough support for nurses. And that's something that absolutely needs to change. And then as the report showed, Shauna, that where those investments have been made have been in very narrow areas. Someone could say that a gift to build a new hospital wing supports nursing. Absolutely. What we were really looking at, though, was nurse-driven programs where nursing is front and center. So when we started this work, we were looking for a bit of an environmental assessment, and then we were looking for what is the message and what has been supported. And wonderfully, education is something that when people support nursing, that's a place that they put their dollars. Almost 3/4 of the investments are in education. And the pipeline is absolutely important, but a pipeline to graduate nurses who then find that this working environment is not at all necessarily what they were educated for, or a place that is going to enable them to thrive as individuals, to be healthy, to deliver the very best care. That's something that this report, I think, nicely pointed out, that it is not just about scholarships for nurses. We need to support nursing leadership. We need to put money into a better diversity among the nurses in this country. So bringing more diversity into the nursing field, and then truly supporting the leaders in nursing. And most importantly, how and where care is provided. You can bring wonderful people into the profession, but you're not really keeping your contract with them if you are graduating them into environments where they can't practice to the full ability, to their skill set, to their knowledge. And that's something that I am challenging many people in the philanthropic sector, because most of the dollars are going into academia, that it is academia's problem as well to create a world that their graduates want to work in and can work in. And one thing that I am really hopeful about is that the newer, younger, or newer to the profession nurses, they have in some ways higher expectations of what is a reasonable job and not having to compromise their health and well-being. And I see in that a real ability to change the environment for the workforce to say, this is not okay. So whether it is local government or state government or federal, but it's important that when people invest, they look at the richness and the needs across the nursing profession and not just in education. I am certainly supportive of anyone and everyone who wants to provide financial assistance to nurses. But I think what we're seeing now in the healthcare landscape is it needs to be about more than that. Our leaders in nursing who are so critical to the profession and to how people can thrive every day, they're not invested enough. I think there's probably not a bigger concern right now, certainly in the C-suite of healthcare, than the nursing workforce. That the nursing workforce is plentiful, that it is supported. But how do you do that? Well, you have to do it by supporting them in where and how they work. You have to do it by investing dollars. We've seen some states put really significant dollars into supporting nursing preceptorship, environmental changes. We've seen private sector investment in this. When you think about how much any company, small or large, spends on healthcare, they are now stakeholders in the nursing profession. That's how I look at it. So that is another place where we need to see investment. And it doesn't take 1 cent of every dollar. That is not, it just doesn't make sense. It doesn't make sense. It doesn't make sense to me in what I do for a living, but it really doesn't make sense to me as a person who depends on healthcare. So I'm hoping that while this focus of this report is on philanthropy, that we're going to see, just as we saw in the pandemic, that the economy rests on healthcare, healthcare really rests and depends upon nursing, that it's going to take other sectors to put into dollars into really transforming the nursing workforce, and most importantly, I feel, the places and spaces that they work.
This report, while it is the first of its kind, it is bolstered by so many others who, for quite some time, have been making the same type of strong recommendations. In the foreword of the report, you said, transformation of our complex healthcare system requires vision, innovation, and dedication to long-term change, as well as substantial funding. Can you put a number on what's meant by substantial funding?
Nursing represents probably 10 to 12% of the overall annual spend in healthcare. So, Shauna, you ask an interesting question, like, what is the big number? I think in some ways we can't think big enough. I've started to talk about, nursing needs $1 billion investment a year. And some people say, oh my gosh, that's so much. That's only 2 cents of every healthcare philanthropy dollar, right? And again, we're only
talking about philanthropy.
We're only talking about philanthropy. Yeah. We're not talking about the $4.4 trillion that is spent in healthcare delivery. So what is the right amount? Yeah. I mean, I think that we have to look really boldly and not just say we need investments, but really be able to describe what those investments look like. For us, part of this report was some work that we call reimagining nursing. It's an initiative that we started several years ago to bring philanthropic dollars to nursing and then put those dollars in the hands of really brilliant nurse innovators in a number of different ways. And that's just a start to what we need to do. If you looked at all the dollars that are given in healthcare and imagine, well, what if 20% of that went to nursing? It would be mind-boggling, Shauna. So much could change. And I think so much could change very quickly because nurses have an extraordinarily unique perspective, and they're not replacing other care providers, but that perspective for me is the perspective to be invested in. So while I have said out there many times $1 billion, and sometimes people think, oh, that sounds like so much. It actually is a very little of the dollars given in philanthropy, and not even a speck on the 4.4 trillion invested in healthcare annually. It isn't that the money doesn't exist in the economy or in philanthropy. It's just not being spent, I think, in the most strategic way. And so for us, this looks like funding projects that can really tie the outcome and the value of what nurses bring to care delivery, and use that as more evidence about why we need the world of the healthcare care to recognize and support and not look at nursing as a cost, but as a generator of health. One of the projects that we have had the privilege of supporting through the generosity of people like Kaiser Permanente and other funders is something called Navi Nurses out of Phoenix. I don't know if you know, Shauna, of Navi
I
Nurses.
do. I know Navi, and I'm a huge fan of Jasmine Body. She's creating a whole new category of care that we haven't heard of, but I think in the coming years we're gonna be talking about transition care like we talk about hospice or maternity care.
We've seen her not only in her wonderful and vibrant company that is a healthcare provider, but also I think it is a nursing, not just an innovator, but an inspiration. You know, in philanthropy, sometimes you start to support a project because you believe it's moving in the right direction. And then sometimes there's the unexpected outcomes. And one of the things that we just are so appreciative about the way that Jasmine works in Navi Nurses and leads in Navi Nurses is that nurses are not just delivering this fabulous care. So a nurse really going home with the patient that very day that they are discharged from a hospital, and really in their quieter environment where someone can actually take in and have a conversation about their care, their medication, all the things that are going to make a difference about whether they get readmitted to the hospital. But what also the unintended outcome is that those nurses are really happy. They are doing the work that they got into the nursing field to do. And as one of them said to me, now that I'm providing this care in the home, this nurse also provides care in a hospital. She said, I'm a better provider in that hospital because I now see all of what goes on in the home, and I'm asking different questions. And I am really happy at what I do. The Reimagining Nursing Initiative is to help prepare nurses for an ever-changing world, and mostly to provide dollars so that their innovation, knowledge, and expertise can drive solutions that can scale. For us in philanthropy, that's the big piece. How do we actually get change to happen? And when it's good change, happen again and again and again. One of the projects that we're supporting is something called Concern, which is communicating narrative concerns entered by RNs. What does that mean? It's a project out of Columbia University that brilliant nurse leaders have brought AI, machine learning, into the care environment so that how nurses document and chart, and when they do, drawing upon AI and machine learning, we then have better predictors of when a patient is going to deteriorate. And so this model was created. And then what we did was provide funding so it could be scaled. It could be transferred to other institutions, really creating a playbook so that a brilliant idea in one place can move to a brilliant idea and implementation in another place. And it for us is an example, and we've got 10 fabulous projects in the Reimagining Nursing work that we're doing that all can, we believe, create very positive change, draw upon nurses' innovation, their way of solving problems, and their ability to really break through some of the long-standing challenges and create solutions that can make a difference. And for us, be bold and be scalable. But it isn't inexpensive to do this.
Yeah.
And as people who need good healthcare, we all deserve for the investments to be made in places where a difference can be made. I think that investing in nursing ingenuity is one of the best ways you can invest. And there's now philanthropists, Shauna, who I think are making business decisions. Philanthropy is often an emotional place and space, but I think there are philanthropists who really made a business decision. It's a good place to invest dollars.
You mentioned that a lot of philanthropy is emotional, that it's tied to wanting to be generous. So how can we make sure that those instincts, those generosity instincts, that each one of those very precious dollars can have the greatest amount of sustained and positive impact?
Well, I think you asked such a great question about how does every dollar make a difference? And I would never criticize a philanthropic dollar, given whether it's $1 or it's $100 million, because I think all of those dollars make the world good. I know that our work has been in Reimagining Nursing to say lots of dollars have been given away, but where is the change most possible? And I see, one gift that I would talk about as a really interesting and innovative investment is the gift by Len Lauder to the University of Pennsylvania School of Nursing to endow a program for nurse practitioners to be able to come into the profession, not leave with debt, because that's a place where in a master's education program you often are leaving with debt, and they can really bring their skills and their abilities out into the community. There's so much care that needs to be provided in rural communities. I think that was a really savvy investment because it said, not just I'm going to put dollars in today, but I'm going to put them in forever. And that, for me, is about the future of investment. I think of a investment outside of philanthropy. The state of Arizona is putting about $75 million into nursing education, not just for a nurse to get scholarship dollars to become a nurse, but really to improve how that education is happening, how preceptors and nurses work together as a nurse is learning how to be and prepare for the environment that they're going to practice in. When significant investments are made, that is what's going to change the environment. That is going to be, I believe, the way forward for a better healthcare system. And when nurses' creativity and innovation is given ground to sprout and grow and spread. Shauna, people may be wondering, why invest philanthropic and other dollars in nursing? So philanthropy really is about a healing of the world, a care and a love for people. And I believe if you want to make the world better, faster, then you go to the people who can do that work. And that's, for me, nursing and nurses. So philanthropy in the hands of nurses provides a new way for them to be powerful partners. And by drawing attention to This is an area that when you invest, you see great things happen. Whether you're working in healthcare or outside and depending upon it, it's going to take a different set of solutions, and I believe a different group of people being at the table to create those solutions. And that's the power of philanthropy. Investing in nurses to have them have the space and time and bring their expertise to the world of really reinventing, reimagining, rebuilding. Nursing really needs to be a part of it, and they have to be part of leading that change. We hope this report really is a call to action so that people invest their dollars wisely. They invest them in nursing, and they invest them in the spaces that nursing really hasn't had resources in the past. Leadership, workforce development, new models of care. I think the greatest challenge is for philanthropy to think as boldly as it can, to think as big and as radically as it can to make changes. And I would say that over my 3 decades, I'm looking at it in a different way than I ever did before. And I think it takes the boldest and the biggest thinking to do what needs to be done, both within healthcare and then truly for the nursing profession.
Kate Judge is the recent executive director of the American Nurses Foundation, who commissioned the first ever report on philanthropic support for the nursing profession. So, picking up on her theme of bold thinking and the importance and urgency of strategically investing in nurses and nursing expertise, up next, we meet a seasoned philanthropist, a foundation executive director, and a nursing executive who are all committed to nurses receiving the financial support that honors nursing greatness.
Hi, my name's Karen Grimley. I am the Chief Nursing Executive at UCLA Health, and I'm also an Assistant Dean at the UCLA School of Nursing.
I'm Rachel Barchie, and I'm the Executive Director of the Mann Family Foundation. I am a recovering attorney and now have been in the philanthropy world for about 9 years, and in recent years through all this work have become an evangelist and champion for nurses and the importance of investing in nurses and nursing.
I am Victoria Sims. I'm a psychologist, and I'm the president of the Mann Family Foundation and Institute. As a philanthropist, this has been a wonderful journey for me, and I get a lot of joy and personal fulfillment by participating in all the different projects that we take on in the foundation.
So, Vicki, you have been a pioneer in a lot of different ways, particularly when we think about children and early childhood and parenting. Would you share a little bit about some of your early years in your career and your practice?
Sure. I am from Minneapolis, Minnesota. And growing up, my father had a best friend that was a psychiatrist, and he worked at the University of Minnesota. And I learned a lot from him about psychology and about people. My parents separated when I was about 2 years old, and it was a very difficult time for me. I see myself as having been a very vulnerable child. So I knew I would do something in social services. So I was about 21 years old when I had our first child. I didn't know anything about babies. I didn't know anything about children. And here I was. I never babysat. And here I was with 2 young children. And I joined a parenting group, actually the first parenting group probably in the country, at Cedars-Sinai Hospital, where they had psychiatrists, they had an anthropologist, they had a sociologist, and they were all studying the family from birth. In fact, actually, it started prenatally, and you're talking about 50 years ago. So in that, I had been actually at USC, a business major, and I'd kind of forgotten about my psychology interests, but the doctors that were running the program asked me and 2 other gals if we would start parenting programs across the city in LA. And I said, sure. And then that led me to get a master's in early child and then a PhD as a psychoanalyst at the Analytic Institute. And it is through that lens, mind, body, spirit, and emotion, that I really developed my whole person approach. So I've applied it to almost everything that we do because I think it belongs in the arts. We know about music in the mind now. It belongs in psychotherapy. It belongs in physical well-being. So I have integrated it into whatever work we do with almost any organization. Our giving is through a holistic lens in everything, whole body, whole person, whole family, whole community. It's a whole. Pieces fragment. Whole puts everything together.
So you've had a pretty long history of being involved in philanthropy.
Oh, my whole life. I come from a family of philanthropists, yes. I've been involved in philanthropy, really deeply involved in philanthropy, I would say for at least 40 years.
So this is just part of your DNA. This is
part of my DNA. My parents were children of immigrants, and they believed that the world had been good to them and that you give back to the community that was good to you. And that was something that they taught us very early on.
Well, clearly you learned the lessons very well because you do have a very long history and you have a wonderful husband who's been a partner in this. And one of the things that I love about the way you guys describe that is that philanthropy is a creative process.
Yes.
And the two of you bring very different sets of skills that are so important in philanthropy, in giving.
My husband, Ron, is a CPA attorney, a real estate developer. And so he comes to looking at whatever project we fund from the legal lens, from the accounting lens. And I'm humanistic in my thinking. I like to be creative in the work that we're doing. I want to make an impact. That's really important. And so we share thinking and ideas, and he's very involved. And we've had a lot of fun doing it together. We both feel just very grateful to be able to give back to the community in the ways we've been able to. It's been a very wonderful journey for us.
So, Vicki, what was it that drew you into holistic care?
The part that really significantly drew me into holistic care. My father, about 30 years ago, was diagnosed with lymphoma, and he also had a rare disease called Evans. And in that, I spent 6 to 7 years in and out of the hospital with him. He was in the hospital over 350 days. And so I learned a lot about medical care. I learned a lot about doctors working in hospitals. That's where I really got to know nurses. So in that period of time, we did acupuncture, we did mindfulness, we did spirituality, many, many aspects to try to give him some joy in his life, ways of connecting to the community, ways of connecting to his family. And in that, after he died, I joined a national board on integrative medicine. And I realized how important it was, but I also began to realize that places like Venice Family Clinic, which is the largest free clinic in the world, we're not looking at the whole person in preventative ways. So that's when I started to talk to them and to talk to UCLA, because we started UCLA Integrative Oncology at about the same time. And it was very interesting. When we started with Venice Family, they would not use the word integrative care. Venice Family is a health and wellness center. UCLA did decide in oncology to call it integrative oncology. And that was a very big transformation at that time. It's a very exciting time. And now they use it in all their clinics.
So, Vicki, did you want to say more about some of the experiences that you've had in healthcare? And I'm thinking very specifically how they gave you greater insights into nurses, their expertise, the need to have greater investment in nursing.
Well, I think my personal experience with my father really was the experience that gave me a true understanding of the importance of nursing and the relationship that nurses build with their patient is so important for the well-being, the emotional and I think physical well-being. And my father's long illness really provided the opportunity for me to really understand and work with nurses. And I realized what hard work it is also, because I watched them having to really manage and integrate, and working with the families as well as the doctors and the nurses. It's a very important role.
Over your 40 years in philanthropy, you've had a lot of involvement in healthcare and in health systems. Nursing has become a very clear and very specific giving interest. Can you say more about how nursing became something where you wanted to spend more time and more depth in your understanding in the giving?
I think, Shauna, that started about 10 years ago when I met you, when I realized that there was a crisis in American healthcare. And I was on the board of Children's Hospital, involved with UCLA. I'm on many boards and involved with different organizations. And I realized where we were in terms of our own medical care in this country. And I think at that point, I connected with you and thought about doing a chair or getting involved in some way with one of the hospitals in looking at what we could do and what we could fund in nursing. And that's when we started and did a chair at Cedars in nursing education.
Yeah, the foundation ended up endowing a chair in nurse education, innovation, and research. And our thought was there needs to be lots of different pathways for ways that nurses can develop their skills, in their careers and show up in the world. And we wanted to make sure that nurses, and we did it specifically at Cedars, were getting all of those opportunities to get the training that they needed, to get the professional development that they needed, to be able to be innovators, to have their voices heard, to have a seat at the table, to be researchers and involved in all of those different ways. And so the idea was that having an endowed chair overseeing that whole piece of things would really elevate that work within the institution.
At the end of 2023, the American Nurses Foundation released the philanthropic support for the nursing profession. What were your impressions of the report? Any findings or insights that surprised you, things that resonated with you?
I mean, I think that our instincts and anecdotally, we had an understanding that nurses and nursing were being underfunded, undersupported. But it was still very stunning to read the statistic that only 1 penny of every dollar of healthcare philanthropy goes to nurses and nursing. And the fact that the vast majority of that funding, particularly a lot of this funding does come out of private foundations, that the vast majority of that funding is going to education and training of nurses, but is really not looking at this issue of just the huge leak in the pipeline of all of these established, skilled, talented nurses who are leaving. And so that, I think, it's confirmed what we had already thought. And I think it's just given us even more resolve to understand the massive need to be investing in nurses and nursing at this time.
The goal that we had after looking at what was happening in nursing was to elevate a public awareness what was happening, hoping that we could get others to join us in funding nursing.
Karen, I want to bring you in here and get your impressions of the findings on the American Nurses Foundation Philanthropy Report. What stood out to you? I mean, what was your reaction to the 1% of funding?
When you talk about the 1% of the money that we do get, and I think the thing is that 1%, in a perfect world, that 1% would be aimed at helping people be more innovative, study biodesign, study ways to develop and enhance themselves as a nurse to contribute to other things, not their in-service education for annual skills and competencies. So one of the things I do appreciate about the Family Foundation and what Vicki's done is, with great intention, there's an expectation of money gets put in the right places to invest in our nurses. I can onboard new nurses all the time. But the thing is that the people I have here now that have 10, 15, 20 years, those are the people I need to invest in. Those are the people that we need to stimulate opportunities for them to be a biodesign fellow or an informatics fellow. And so I think with the work that that Vicki and the Sims Mann Family Foundation is doing, elevating the need, but also elevating the benefit of what this is going to do for health, well-being, and community health it's exponential what the money can do in the right places. I know the money's out there. We put ourselves out there to be available to accept money. But the thing is that it doesn't always quite get to nursing.
Thank you, Karen. And I think also that we have to make sure that nurses have more career opportunities, as you said, different pathways. We really need to emphasize that and provide them with the support for those opportunities.
I agree. I have a philosophy here, and it's shared by UCLA. This is a career home for anybody who starts here. So my job is to figure out, if you want to do something different, how do we create the pathway for you? And we can do it individually or we can do it in groups. We're able to demonstrate the benefit. The cost of recruitment and retention in the country right now for nursing is off the charts. I know how important it is to really invest in people, make sure the environment is right, the opportunities are right. And if all that lines up, the patient benefits and so do the nurses.
One of our goals is to show that nurses are healthcare experts, that they really are the backbone of our healthcare systems. They're the ones who are going to drive better care. They're the ones who are going to lead to health equity. They're scientists, they're researchers, they're innovators, they're leaders. They are also caring and compassionate. If you ask anyone, people will tell you about these extraordinary experiences, but I think it takes doing a deeper dive to really understand all that lays behind that care that makes people feel so deeply cared for and taken care of.
You know, the most important thing, it's not the task that a nurse does, it's the clinical judgment and the critical thinking behind it. That's where the education and the preparation and the professional development, how they learn to grow and build. You know, the investment, having preceptors on every unit to help support that new person who's trying to learn how to coordinate and manage. I mean, these are huge, huge things that really need to be in place to create a workforce that is not only doing all the right things, but they're also engaged and they feel safe so that they can provide high quality care to the people they care for and their colleagues. You know, when you talk about, you said caring and compassionate, and, you know, I keep thinking of all those people who thank nurses. It's very nice, but it's hard because that's a lot of times how people think they need to show gratitude to nurses. It would be nice for people to translate their gratitude into things that really honor what it takes to be a nurse. When you look at the high-tech stuff they're doing in the background and being that compassionate person, that's a rare find. And I'm proud to say I've got about 5,000 of them here doing that every day. But, you know, it takes tending and feeding, right? So there's a lot to be said for what an acknowledgement like the Sims have put forward is doing for the team here.
I think that's a really good way to launch into the Sims Mann Off the Chart Rewarding Nursing Greatness.
So Off the Chart is a minimum 3-year campaign that the foundation launched last year. So we're now in year 2. In terms of the criteria for Off the Chart, it is sort of different. We are trying to look at people who may not be recognized or celebrated by traditional metrics. So for Off the Chart, the criteria are people who exhibit a bias towards action, people who have a capacity for self-direction, originality and creative instincts, courageous and bold thinking, and most importantly, the potential to achieve even more. We're looking at people at all career stages, at all backgrounds, all specialty areas, but we are indexing higher maybe on people who are earlier stage career because we are not considering this to be a lifetime achievement award. This is really supposed to be, you know, what are people already doing and what do they have the potential to achieve, you know, over the course of their career and life. And this year we're working with 4 different health systems. So UCLA Health, Keck Medicine of USC, City of Hope, and Cedars-Sinai. And the health systems have selected 10 nurses from each system to receive from the foundation a no strings attached $10,000 gift in appreciation for the nurses' leadership and ingenuity in caring for their fellow humans and future generations. It was really important to us to be working with the people who are working with these nurses day in and day out. And so what we asked each of the health systems to do is to tap on the shoulder a confidential group of nominators from everywhere in the health system. So anywhere from chaplains to pharmacists to physicians, anywhere in the health system, the more diverse, the better, to really try to uncover and unearth that nursing greatness that may not otherwise be seen by folks. And we just thought that that was the best way to get at those nurses, those diamonds that are not otherwise being seen. So off the chart, there's sort of two goals with this. One was really to give a boost to these nurses, an expression of gratitude and trust, saying thank you for the exceptional work that you've already done in caring for people and communities. And then the second is trying to shine a light more broadly and elevate nurses in the public eye and letting people know that nurses really are those critical healthcare experts. And we are in a nursing workforce and nursing care crisis, and we need urgent investment and action. And so trying to bring that level of awareness and urgency to this situation through this campaign by working with the health systems, putting it out in media, social media, and using our own platform to shine a light on these issues. One of the things that's come out of it that's been really wonderful is we've gotten to know some of the large national nursing funders who are doing really amazing work, in different areas, who have committed millions, billions of dollars collectively to nursing. But I think the thing is that you don't have to be a funder who is committing your whole portfolio to nursing to really make an impact. So when you're going back to the philanthropy report, if you have 1%, the total spending that the report shares for healthcare each year is about $50 billion. So that means that nursing is getting about $500 million. Well, if we could even just get it up from 1% to 2%, then suddenly that's $1 billion. If we can get people to give 10% to nursing, then that's $5 billion. That's a game changer. So how can we get people, because there's so many people and foundations out there who obviously are funding healthcare because it affects us all. It affects our health and the health of our nation. How can we get them to look at nursing as an integral part of that?
Say more about how you've been on that leading edge, that pioneering place of bringing technology into a place that maybe it feels like wouldn't, if in a whole person approach.
The Mann Institute really focuses on developing programs that relate to early child development based in the latest neuroscience. And so the most recent project that we're working on is in collaboration with a company called Baby Live Advice, founded by a nurse, so nurse-led innovation, a nurse named Siggy Marmerstein. And it is an organization that provides maternal and infant care via telehealth all over the country. They have a whole team of nurses, nutritionists, therapists, providing that wraparound care from prenatal through the first year of life. And so we've now partnered with them to provide classes to parents that are focused on the social emotional learning of how do you connect with your baby? How do you build in those routines and rituals? How do you deal with those tough separations? All those things that can really come up for parents in that first year of a baby's life, but that really, we know through the science, really form the foundation for lifelong health and well-being for children and thriving families. They're really helping to fill in some of these gaps that we see in maternal care across the country and healthcare deserts and more rural areas. So they're really meeting a huge need, and we're happy to be able to be a part of that, providing that social emotional piece.
Karen, as a partner in Off the Chart and a leader at UCLA Health, can you share what your experience and the benefits have been of being on the recipient side of being a partner?
So the first year, we were amazed at the stories we got. They were talking about things that were really significant. People who were designing better ways to use the electronic medical record through redesign. One of the nurses, Lindsay Brandt, with her death doula program. This program They had been working on that in her unit. It was her brainchild. But had we not done the off-the-chart recognition that had the nominators that we had, we never would have known that because she was so humble about it. So Lindsay Brandt is absolutely amazing. I was familiar with her because of the work she had done in women's health in Thailand. That's how I met Lindsay. And she's a cardiovascular intensive care nurse. So here is a person who has just a depth and breadth of knowledge and capability and putting herself out there. And for her to be recognized, that really embodies what nursing greatness is, right? Somebody who has courage to try something different, somebody who's not afraid. She's not afraid to speak up. And I think that the people who have been on the different nominating group and the selection group, they have gotten such a bird's eye view of the variety of things that nurses can do. They have become spokespeople and in some cases cheerleaders for nurses in a variety of settings across the health system and beyond. So I think it's been such a blessing for not only the people receiving the gifts, but the people who have been able to be involved in helping select the recipients. And the fact that someone would write a check with no strings attached for $10,000, I have to tell you, has been probably one of the most mind-blowing things for the nurses because they're used to getting a box of candy. Now somebody has actually said to them, we value you. What you are doing is significant. And please accept this as a small token of our appreciation, which is probably the largest token they've ever received, right? And I think we've all learned something. We've all learned about the extraordinary things that nurses do in the course of their ordinary days and their ordinary lives. And it's nice for us to be able to celebrate it and take advantage of it when recruiting and educating people about who nurses are at UCLA Health.
You mentioned having the courage to speak up. I'm thinking about David Yamada, one of your recipients, and he is a union representative. And that's a really tough role. And we don't think oftentimes our sense about how we look at nursing greatness or nursing excellence would be directed at patient care.
David's a great case in point because David's greatness came in his ability to help me and nursing leadership partner better with the nursing union, because those are two groups that can't be at odds. And when you step back and look at it, the union wants the same thing we do. We want a safe environment, excellent patient care, and nurses who are able to function at the top of their license. We have different ways we go about advocating for it, but we're pretty much in line. And I think the people who nominated him saw that as a strength and saw that as a turning point for us. What I've seen happen with our 10 recipients last year is people have moved towards them. They've been drawn to them to hear about their stories. Chris Lee, he's designed a program that's going to help us have our environmental service workers and our security guards and people like that actually be able to enroll in a nursing assistant program as part of their work. The off-the-chart recognition that he got for his work, when you look at what he's been able to do with this idea, we're going to take our first students in June. So not only do people in nursing know that, but so do the people in environmental services, in food and nutrition, security, any of the places that are around nursing and nursing care. It's really lifted up a lot of people inside the organization in a very new and different way.
Christopher has been a nurse for just at 5 years now. I mean,
just barely, yeah. Mm-hmm.
Just barely at 5 years.
And there's nothing like fresh new eyes to help us do a better job. Yeah. So I think that's a lot of what's happened here is that now they have a little bit more free reign and people kind of know who they are. And I have to say they're shaking up the status quo. Our education department is having to rethink how we should be educating nurses, or what types of courses we need to develop to, enhance career opportunities. So it's been a great stimulus for everyone.
Piggybacking on some of the things Karen was saying, a couple of the things that we've seen, one, when you talked about how the people who were the nominators and selectors, how they got the bird's eye view, they are coming into this saying, thank you, Karen, for including me in this process, because it's been so inspiring and humbling and amazing to read the stories of these nurses. So that felt very good, because that was one of our goals. But then also just getting to know these nurses and then getting to hear the impact that it's had to propel them forward in their journeys and their careers has been really exceptional. Lindsay Brandt, I had spoken to a few weeks ago, and so I'd gotten to hear a bit about the Death Doula program. And, it's really inspiring us at the foundation to start to look in different areas. So end of life is an area that the foundation has been interested in for a long time. And hearing what Lindsay is doing, it's something that we're going to start exploring again. I think that now we have a large brain trust of amazing expert nurses who are going to inform us on what they're working on and what's cutting edge and what we should be looking at next.
And also, Rachel, maybe you would want to speak towards our partnership with the 4 hospitals. We have learned a lot from them about what's happening in our hospitals today, and it has given us a lot of insight in terms of where we want to move forward.
It really has given us, in a way, a bird's eye view of how all of the different systems are working, which each, operate very differently, but just understanding a little bit better what the needs are of the different systems, of the nurses within those systems. And that's been very educational to us as we think about putting together future programming.
This has been a wonderful one. I wasn't even expecting off the chart to be as joyful as it is, but it's been a wonderful, joyful experience. And Karen, I want to thank you too much. You've been wonderful to work with. It's been such a pleasure.
You know what I really appreciate is your candor, Vicki.
Sometimes.
No, honestly, it gets back to that whole thing. People have to speak up, right? I mean, how do we fix things? How do we approach things to try to figure out solutions to issues? It's somebody's told you for all the right reasons where the opportunity is.
When you're doing philanthropy, a lot of times people tell you what you want to hear, but not really what's true. And I only want to know what's true. And if there's a problem, let's fix it together. I appreciate the honesty and the sincerity in that, because we all want the best at the end.
When you look at the ANF report on philanthropic support for the nursing profession, they had a set of recommendations. What are your calls to action? What are your concerns if we don't invest in nurses, or it's insufficient, or it's just too slow? So yeah, your thoughts and recommendations coming from a place of experience and a lot of work in this area of investing in nurses.
I think I'll tackle the question of what happens if we don't, because I think that's really part of what we're trying to call attention to. What we've seen is when there's a shortage of expert nursing care in all the places where we need it, care gets delayed. I've certainly experienced this. I'm sure anybody listening has experienced delays in care. The quality of care goes down, the costs go up, people feel less cared for. And so this really is in a way, a life or death situation. I mean, this is something that really needs to be put on the front burner now, yesterday.
You know what's so nice, Rachel, that you've said that? Nurses have been saying things like this for 100 years. So when you have people supporting that voice, like the work that you're doing with the foundation and you're trying to garner others to do, that's when you get that groundswell of information and call to action. And that's what we need. We need that level of support and that megaphone. Because when I say it, it sounds like I'm whining. Even with evidence, it sounds like I'm whining. But when you say it and when Vicki says it, suddenly people take heed. And that's what we need. We need people to know it's dire. So it would be nice for us to figure out a way to make sure that people who are trying to move money towards nursing understand there's more than just a school or something in their neighborhood that they can invest in. And that's probably been one of my biggest aha moments, because the health systems that are trying to foster the growth of the nursing profession get very little attention and very little funding. Like you said, 75% of that 1% is going towards something other than what's going on in the health systems. And it's only getting more technical and more complicated. So thank you for your support. You have no idea how important it is.
If we don't support nurses now, the stress on the whole medical system is going to be so huge that it's going to be even more of a crisis.
Yep.
But I think also in this, something that I didn't speak to before, and I think it's important that we do look at, is the quality of lifestyle that a nurse has and the stress that they're under, which Karen spoke about, how they have to manage so much. But their own health and well-being, I think, is something that we really have to acknowledge and look at and help them support each other in healthy lifestyle.
I think that the opportunity we have at hand is we can invest in nursing in such a way that we promote the profession and ensure the safety and the high quality care necessary to help patients heal and get back to their lives as quickly as possible.
Special thanks to our episode guests, Karen Grimley, Chief Nursing Executive at UCLA Health, from the Sims Mann Family Foundation, Rachel Barchie, Executive Director, and Victoria Sims, Philanthropist and President. And we started off our episode by talking with Kate Judge, who is the recent Executive Director of the American Nurses Foundation, who commissioned the first ever report on philanthropic support for the nursing profession. Up next, with investing in nurses.
There's 2 million open jobs, and that's only expected to double in the coming years. Many of those are in nursing.
Whatever impact we can make in either nursing education or nursing workforce or nursing perception, it will impact every single individual nurse.
Each nurse's journey is different and unique. So one of the first things we did in looking at the strategies and going back and reflecting on our learnings was developing this mapping of what we call a nurse's journey. And so there's 3 key stages there. There's the root, grow, and bloom.
Our approach is really that we test something out with our philanthropy, but that private institutions take it over or makes a case for federal government. And we have seen that in a lot of other programs.
Well, we were absolutely thrilled when we received a phone call from Bloomberg Philanthropies that they were interested in learning more about our model, but even more so thrilled that this is a comprehensive partnership. This is with Bloomberg Philanthropies and their investment, not only in the Nurses Middle College, but in this space. They provide assistance with strategy, with resources. They're a thought partner. They're a cheerleader. They've built infrastructure.
For See You Now, I'm Shauna Butler. Thanks for listening.
Nurses are transforming healthcare through innovation, compassion, and leadership. And Johnson & Johnson is proud to continue its 125-year commitment to champion nurses through recognition, skill building, leadership development, and more. The American Nurses Association is dedicated to building a culture of innovation. Nurses improve the lives of patients and communities through innovative thinking, empathetic connection, scientific rigor, and sheer determination. ANA is proud to support and advocate for our nation's most valuable healthcare resource, our nurses. For more information on See You Now and to listen to any of the earlier episodes in our library, visit seeyounowpodcast.com.